Thank you for coming to the 2026 LoVasco Benefits Briefing. My name is Mike LoVasco. I know many of you in the room. There's some new faces. This is our, I think, third or fourth session we've had each year, and it's growing, and so we really appreciate the support. Last year when we started this event, we had a wonderful slide deck, and we walked through some healthcare trends. This year I want to just, get some input from the room, because healthcare costs are impacting all of us. So play along with me here and raise your hand if your renewal increase for 2026 was over 5%. Over 5%. Okay, a lot of hands in there. Keep them up, if you will. Over 5%. If your healthcare renewal was 10%, keep your hand in the air. 10% or greater. Okay, see some hands. You know where this is going. All right, 15% healthcare increase. A couple hands, one or two. 20 and up. 20 and up. Okay. We got 20. Really interesting year from a healthcare perspective. And I think everyone in this room is interested in controlling costs, and that's why we're here today. We've got 4 sessions. We're focused on big picture ideas. We're not going to be talking about plan design and copays and deductibles. That's really not what we're focused on today. I want to encourage everyone to stay open-minded and not fall into the trap of, hey, that sounds like a great idea, but it would never work at my company. That's a dangerous trap, so we're going to try to avoid that as well. Before we begin, I would like to thank our sponsors. We've got Centro, Joe, and Suzanne. They're going to be joining us a little bit later. Delta Dental, Nick and Rob. They're also late to the party. But Plum Health is not. Dr. Paul, Thomas, Tom DeGuano. Just give us a quick hand raise, if you will. Thank you guys for the support. We'll hear from Dr. Thomas a little bit later. I'd also like to thank my coworkers, the entire benefits team at LoVasco. We've got some of our retirement plan consulting team members here as well, and some of our staff. So thanks, everyone, for joining us. A couple housekeeping items. Obviously, breakfast and coffee. You guys know where that stuff is. There is a restroom around the corner as well. We'll take a break around 10:05, give or take. And as you can tell, we're recording this session today. So we're going to be able to reflect back on it and kind of continue to build momentum and share this story. So if you have any reflections during the session today, I might tap you on the shoulder. If we can get a quick soundbite from you, that would be great. So with that, I would like to introduce my colleague, Luke Trocchio, the man on the mission and the MC for our session today. Welcome, Luke.
Okay. When we walk into a healthcare provider's office, a very powerful thing happens, and we're often so conditioned to not even think twice about it. Or maybe we do think twice about it, but we don't think 3 times. What's the first question they ask you? What's your insurance? And that's no poo-poo on them. Oftentimes it's before your name. It's what's your insurance? It's like the first thing that comes out. And I don't blame them. They're just making sure they're going to get paid, and we want them to get paid. The next question I have for all of us is, who is actually paying them? Is it the insurance company? I know, let's ignore deductibles, copays, and all that. Is it the insurance company, or is it the employers and your employees through premiums and claims? The reality is it is us. We are paying for these things. And we have some of the most impressive minds and technology in medicine in the world. I could spend a lot of time just in my own thoughts reflecting on what's possible, but we have the ability to take a human heart from a person that just passed away 4 hours ago and move it into a living, breathing body and fire it up like it's a piece of equipment. Blows my mind, as it should. And, I know there's a lot that goes into the purchasing of healthcare. I don't want to oversimplify that, so please don't accuse me of that yet. But if one of the things we're struggling with is how much things cost, right, prior to getting care, Let me just use a blunt example. If we walk in there with a bucket of cash, I think they're going to tell us how much it costs because we're helping them get a little closer to the money. Again, I know I'm oversimplifying, but hopefully we can all kind of picture what I'm getting at. Most employers in the room here, we spend enough money on healthcare, but one of the main questions still lies, and that is whether we really realize where it's all going and why sometimes it feels so far away and what it is that we can really do about it. So today, like Mike said, it's unfortunately not about, hey, how do we just save 10%? What's the magic bullet? What's this thing that I can hurry up and plug in to save me X amount? That's not what we're here to do today. I think if we do that, there will be a moment that we're missing. This is also not like a fake motivation speech. I mean that, and I believe that. Today, we are trying to raise the awareness for how the system actually works, and we've got some folks that can come and speak with clarity on some of these items. And we want to bring to light some of the questions that I hope that you've already had, as we think about the things that happen, the stories that people go through. We want to answer some of those things, and we also hope that you leave asking new questions and having more questions. To be clear, we're not trying to poke holes or complain about our healthcare system. I know it's a hot topic, but I believe that there's hope. I think that there are a lot of things that are possible, and it could be better. So that's what we're doing today. Again, my name is Luke Trocchio. It's good to be with you. I'm going to be up here hanging out with you and moderating some of the sessions and asking clarifying questions, but a little bit more about me and just kind of what gets me up every day as it relates to trying to solve some of these challenges that we face. I've got 2 reasons. One, it's very cliche. Everybody says it, but I think most people mean it. I like to help people and solve problems. Plain and simple. Like many of us as well, I got this thing inside of me that when I see something that's just not right, or maybe asinine, if I can use the word, that it just, I lean in and I ask more and more questions, and I'm just like, that cannot be. Whatever the topic is, I think we can all use our imagination as it relates to this, fighting the good fight on healthcare costs. So that's the first reason. The second is that I think about health every day. I know I look healthy. I am healthy. But when I say that, I think about it for myself, my children, my wife, my family and friends, and just how fragile it really is. I know that, hey, I'm healthy, I'm strong today. I could leave here and get in a car accident, or tomorrow I could just develop this condition, and it changes your life. So I think about that every single day, not in a fearful way, but just in a way that just kind of sets me free and points towards gratitude. And I'm not trying to give you a sermon here about life and death, although I'd love to do that another day. If you want to chat with me, we could do it. But I bring it up because if we're going to talk about the cost piece, we cannot lose the human element. And I think a lot of times, especially as y'all are navigating change for your workforce and yourself and your company, it can feel like, well, it's either cost or, care. And I get we're towing the line with some of that. So we don't want to lose sight of the folks that have been, as we're talking about cost, we cannot lose sight of even just the sheer numbers in this room, that there's probably 5, maybe 10 people that have been brutally impacted by something even recent. Loss, a diagnosis, a spouse that's gone through something. So got to acknowledge that as we get creative with different ideas. When it comes to the cost, though, it's that's not the only issue, but it's the visibility and the incentives that are oftentimes unclear. Let me ask you a question. Is there any, you've probably heard this many times, so forgive me if it's redundant, but is there any other business unit in your company where there's a financial instance or a transaction that's about to happen that's $10,000, $25,000, $50,000, $100,000 that's about to happen, and you really don't have any insight into that decision? You might want to bring on a new hire. Are we going to pay him $80,000 or $90,000 or $85,000? There's some insight into that, but this is next to nothing. But again, you as an employer, you're paying for these things for your workforce. even if you're fully insured, I know that we got a mixed crowd here. The reality is, and again, it might seem like I'm oversimplifying. I know there's risk factors to consider, but the bottom line is it's still very similar and the same. It's just a matter of when you're paying for them. And we hear about these things when we sit down with your employees at open enrollment, which is one of my what's it called, greatest pastimes, or my things I like most about getting to do what we do. We help people answer their questions and get their plans picked, and then what I like to do is kind of lean in a little bit and get curious and say, hey, glad we helped you out. Is there any other questions or anything else you're thinking about? Like, is it, I'm gentle. I'm not like trying to get into people's business, but then they start talking, then, you know what, I actually, I got a surgery coming up, and I'm not sure how much it's going to cost, or I wanted to know what my copay was because I have congestive heart failure, and I take this medication, but you know what, now that we're talking about it, I haven't seen a doctor in a while. And I give you these examples because the reality is when they get their insurance card in the mail, they're all squared away, there's just different levels of risk that are walking around in our workforce. There's low, there's moderate, and high risk, and everything in between. Let me just come with me for a second here. It's not going to take too long. Let's just think about the organizations, the largest companies in the world that spend the most amount of money on healthcare, hundreds of millions of dollars. Companies like Walmart, Boeing, Fortune 100 companies. Let me just give you one example. They have special programs. This is just an example where if you're an employee and you have a high, a complex condition, a cardiac need, let's just say an open heart surgery, for example, and they incentivize you as an employee, if you use our top facility with our top provider group, we're going to fly you out to state A, B, and C, and you can stay at the hotel for free. We will pay for the entire thing for you. And I just sit there and ask myself, as we're, in the smaller to mid-sized group, like, why would they do that? Is it just because they care about and love their employees? I'm sure they do, but I'm led to believe there's some kind of win-win in that. And I also think that's not health insurance. That's like deep healthcare strategy. Deep healthcare risk management strategy. And I know that sounds wildly overwhelming and not necessarily suggesting, hey, you guys go do that, find a way to do it with your company. I'm not suggesting it either. But we're just inviting you to think a little different about this, for the sustainability of your workforce and ourselves and kind of all in this together. Especially in today's environment when most employers just feel like they're stuck dealing with this thing. And I know there's a lot of us, not like it's an obligation and they don't want to care for their employees. I know you do. But it's just this thing that's happening to us, especially from a financial perspective. And employers either feel like they're too small, or hey, if we make a change, our workforce is just they're going to uproar. They control the universe here. Again, just asking you to think a little different this morning about it. And I will encourage you, I'm not trying to falsely inflate your tires, but I believe this. There is an advantage to being small or smaller. And I believe it's the ability to navigate change at a more rapid and precise route than a larger organization just can't. So again, I'm not trying to falsely inflate your tires. I believe that's true. So as we face the rising costs, what's gotten us here today is probably not going to be the same way 10 years, 20 years, 30, 50 years. Like, what could it look like? So the 4 sessions are all connected today. The first one, hospital pricing and economics. A ton of your dollars, your healthcare dollars, are going in that direction. The second one, care navigation, transparency, and advocacy. Don't be lulled by the buzzwords. I'm going to promise you, we're going to try to use plain language. What that basically means is getting people to the right place, having some visibility in the cost, and helping people have a voice, in their decisions. Number 3, the fastest growing part of your spend, which is your pharmacy. And then last, we've had a group of employer leaders that have said, I'm willing to come up and share some of my insights and what we've gone through. So those are the 4 sessions.